Well, my first guests join us via satellite from Toronto with a company called Medizone International, stock symbols MZEI. Mr. Ed Marshall is the CEO of the company. Ed, good to see you again.
Hey, Don.
And of course, with him, of course, is Dr. Michael Shannon, recently named the president of the company. Dr. Shannon, good to see you too.
Pleasure to be here.
Well, Ed, Medizone International describes itself as a company which is in the process of transitioning from pure research and product development into a multifaceted commercial company. Can you give us a brief overview, please?
Sure. We're in the final stage of product development with our production equipment, having taken our many different beta test units into production design now. We'll be actually manufacturing production equipment later this year. And we're introducing this product at the FIME show in Miami in August, which is the largest medical purchasing show of the year in North America. So we're pretty excited. It's a big transition. I think we're going to be very successful.
Well, now, the company's AseptAssure system, Dr. Shannon, can essentially sterilize any environment from hospital surgical rooms, ERs, ICUs, even schools, locker rooms. Tell us about AseptAssure.
Well, we started with a challenge put to ourselves, and my background is infectious disease, and so are my colleagues. The challenge was to try and move the efficacy, the effectiveness of sterilization or decontamination techniques from where it even is today to something that really does achieve the goal of eliminating very, very dangerous pathogens from hospitals. So our target was hospitals. And in that regard, to our great surprise, when we ended up combining two different approaches to decontamination, we moved the yardsticks from something that may sound impressive, so 3 to 4 logs, so 99.9% sounds impressive as a reduction in bacterial count, to 6 to 7 logs. Quite frankly, we don't know what the upper limits are. And what that means is that we've taken something from partial kill to virtually 100%. And why is that important? Well, the importance of that is, the best way to understand it is to think back to what we've all been told about the inappropriate use of antibiotics, where if you don't use the right antibiotic at the right dose for the right amount of time, what you're doing is you're selecting out bacteria that are more robust, more resistant, and you end up with strains then that are very lethal and they can't be treated. Well, the same thing applies to contaminated environments, where if you are only killing off 4 logs worth, so that's 1 in 10,000 left, 4 logs worth of bacteria that are contaminating a space, when there are actually 6 to 7 logs present, that means you're leaving behind 100 to 1,000 bacteria per square millimeter, let's say. And that means that you haven't decontaminated the space, and secondly, you've selected out then bacteria that are far more robust, so you're not doing anybody any service. Quite frankly, you may be doing the hospital a disservice.
Well, now, Ed, the first time you were on the program, you shared an alarming statistic about deaths occurring because of contamination. Can you tell us about that again, please?
Yeah. These numbers are based on CDC analysis, so they're relatively solid, but as good as they get, quite frankly. And the data, which is 2 years old now, very clearly points out that the problem has been getting progressively worse for over the last 2 decades, and right now the estimate is that about 100,000, 99,000 Americans die every year of hospital-acquired infections. But you know what? That's still the tip of the iceberg. They don't talk about, or they try to get around this notion of the morbidity. That's the number of people that are seriously injured and have long-lasting sequelae as a result of these infections. And the CDC in the same article talks about estimates 1.7 million Americans get readmitted to hospitals every single year for hospital-acquired infections. And the price tag is astronomical. It's in the 28 to 35 billion dollars annually is the cost, and that's only the direct cost. Who knows what the indirect cost? So the situation is enormous, and it actually is now spreading beyond hospitals into schools, gymnasia, chronic care homes, hotels. I mean, leading back to the first question, every time we turn around, someone comes up with a new possible application for this technology, and we embrace it, but we're still staying focused for the time being on hospitals. We know that if we can achieve that goal, everything else will fall into place.
Well, Doctor, you've recently been named as company president, as I mentioned at the top of the interview, although your relationship with Medizone goes back many years. What first attracted you to the company?
Well, I've been interested in ozone as it applies to medical issues for almost 2 decades now. And I became, back when I was in the military, became involved with Medizone. I was wearing a different hat at that time, and we were intrigued with the notion that ozone therapy actually may have considerable merit in the treatment of many infectious diseases such as hepatitis C and HIV-1. My rank got too high to continue with the hands-on research, but I stayed involved on the periphery, absolutely fascinated with it. And then most recently, about 2.5 years ago, I was contacted by Mr. Marshall, asked me if I had any ideas on ozone that maybe existing companies hadn't thought about, and it was very evident to me that since ozone is used in water purification plants in at least 3,000 major metropolitan cities around the world, it was actually used initially for the purpose of disinfecting. I thought, well, why, given the problem that we have with hospitals, why should we not at least pursue this line to the point where we can decide whether or not there's any value? So systematic, stepwise process, and it worked out. So it's a real privilege for me now to be part of this team. The team is growing. It's very, very exciting.
Well, I know you touched on a bit of your background, but part of your background is really kind of impressive. Can you share a bit of that with us, please? Well,
I retired from the military as what in the U.S. we would call a rear admiral, and so I was the Deputy Surgeon General. Went on to assist the federal government in reorganizing the blood system. Then went and became the Director General of the Laboratory Center for Disease Control, which is kind of like CDC North. And from there went on into industry. So my background, besides being at one point a hands-on doctor, has been very much involved in public health and infectious disease and disease control. So where I am right now actually makes a huge amount of sense, at least to me.
Medizone International, MZEI is their symbol. Now, Ed, you and I had a conversation a few months ago where you stated that Medizone was moving towards not only being a provider of a product, but actually launching an industry. Please explain that.
Well, yeah, it's very simple, actually. We started out with the idea of looking at the statistics that Mike had produced from CDC relative to suffering and deaths and the cost of, largely preventable hospital-acquired infections. And we figured we could be effective with that. Well, the technology and the science has been so profound and exceeded our expectations that what has happened is it's opened up literally completely different areas to Aseptic Sure that we hadn't considered before, using exactly the same technology because of modular design, so we can do small and large spaces both. So now we've worked with foodborne pathogens. We now know that we can go into food manufacturing plants and eliminate virtually all the illnesses that we see in foodborne pathogens when there's recalls and so forth. We can go into the bioterrorism countermeasures community, we believe. In fact, we actually, Mike might, if we have time here, he should reference that. We have a level 4 laboratory in Canada that's going to be working with our equipment very, very soon now, at their request, by the way, for the A-list pathogens, which are the bioterrorism countermeasure applications. So it's bioterrorism countermeasures, it's hospital and long-term care, it's food processing manufacturing facilities. Recently, we've been very attracted to clean room sterilization. You assume that pharmaceutical companies that have clean rooms for manufacturing pharmaceuticals are sterile. They're not. They have problems too. So virtually any place where you have a bacteria problem, a mold problem, a fungus problem, or a viral problem in some kind of contained space, a manufacturing facility or a human facility, we can address it with Aseptic Sure. So it's an incredible market opportunity.
Now, Aseptic Sure is being officially launched at a premier medical event this summer. You touched on that a moment ago, but give us more details.
Well, the FIME show in August in Miami is the largest medical purchasing show of the year in North America. And we're going to do a product launch there. But leading up to that product launch, keep in mind we have peer-reviewed journal publication that's going to be coming out imminently, and we have Dr. Zoutman from Queen's University going to a number of medical conventions, including the World Health Organization in Geneva in June, to present his findings. So there'll be a lot of information coming out that will verify the science outside of Medizone itself. And then we'll be presenting at the FIME show, where Dr. Zoutman will also be talking to that audience about Aseptic Sure. And it's exciting. We're looking at production, we're looking at sales, and we're looking at huge markets.
Medizone International, MZEI. Gentlemen, why is this a good time right now for folks to take a closer look at your company?
Well, it's real clear. We're just bursting onto the scene. As a peer-reviewed journal article is published, as presentations are made at medical conferences around the world, including the World Health Organization, we go into production. I mean, we're already being contacted literally by high-level laboratories about the possibility of sterilizing laboratories. That in itself, just level 3 and level 4 laboratories, is a $28 million sale in the United States and North America. It's crazy. The hotel industry, the hospitals, I mean, we're talking billion-dollar markets, and this company is about to merge into those markets with fine production equipment, and we're there. We're right there right now.
Medizone International, MZEI. Gentlemen, we're reinitiating coverage of the company. Be watching you over the next several months. I really appreciate you being on with us. Looking forward to more updates. Again, thanks for joining us.
Thank you, Don.